Hello, friends. I am Dr. Rakesh Tirmale, interventional cardiologist, practicing in Mumbai. So today we are going to listen about the rules to be followed by patients after angioplasty or stenting procedure. So many a times I have been asked by these questions after angioplasty by all my patients regarding what should be the rituals or what should be the things that need to be followed after angioplasty. So basically what angioplasty is, it's a common procedure which is done in the management of blocked coronary arteries. However, an understanding of the importance of post-procedure practices from patient is still lacking. There are 5 important rules following the stenting procedure, which is essential for ideal long-term outcomes. So what are the 5 rules? Rule number 1 is post-angioplasty medications. Taking angioplasty medications is very, very important. There is an erroneous belief in many patients that once the procedure is accomplished successfully, medication can be discontinued. No, my friends, this is a very wrong belief. Medications, at least the blood thinners and statins, are mandatory following stent implantation because they prevent the life-threatening complication called as stent thrombosis. So what these blood thinners and statins do is they prevent the clogging of your stents or the arteries again with the blood clots. So post-angioplasty, medications minimum for 1 year are compulsory or as advised by your treating cardiologist. Rule number 2 is keep a watch on your symptoms. Do not ignore or hide your symptoms. Precisely an unusual discomfort in the form of chest pain, dyspepsia, or breathing difficulty. Any kind of symptoms post-angioplasty, it is advisable to get an ECG and consult your cardiologist. No symptom should be ignored, as any complication in the group of patients can be life-threatening. Rule number 3 is dietary modifications. In social context, post-angioplasty, it is very difficult to ask someone or ask our patient to suddenly stop a dietary pattern. It is more rational to follow moderation of the existing diet that they are taking. That is, try and reduce the overall dietary intake by 20 to 30% with the replacement of undesirable food. Diet will be optimized and given advice by your cardiologist as per your underlying risk factors. Depending on your weight, depending on your risk factors like diabetes, blood pressure, cholesterol levels, all these points will be taken into consideration while giving you a dietary advice by your cardiologist. Rule number 4 is exercise. Moderate exercise after stenting procedure is good. Patients should do moderate exercises like walking, brisk walking, cycling, jogging, and gradually increase the intensity of the exercise over a period of 4 weeks. One should reach the pre-disease exercise status within 1 month of the stenting procedure. But heavy exercises like lifting weights or walking upstairs or climbing upstairs should be avoided for at least 4 or 6 weeks. Preferably aerobic exercises should be done. Yoga, meditation, these are all advisable for our group of patients who have undergone angioplasty. Rule number 5 is regular follow-up. Follow-up is a very important thing to be done with your cardiologist or your treating physician. Follow-up are aimed at optimization of the treatment, screening for any adverse effects related to treatment or complications related to your underlying condition, and for controlling of the risk factors. Your doctor will change the frequency of follow-up depending on the clinical situation and your risk profile. Initially, they are at least once a month for a couple of months, and according to your risk factor profile, your cardiologist or your treating physician will advise you to change the frequency. So post-procedure adherence to recommendations are very important for good long-term outcomes. Even if there are small errors in the implementation of follow-up advice, they can result in undesirable consequences in long term. So to summarize the 5 important rules that need to be taken into consideration in all post-angioplasty patients to follow the post-angioplasty medications rigorously. Rule number 2, keep a watch on your symptoms. Rule number 3, dietary modification as per your risk factors being advised by your treating physician. Rule number 4, regular exercises in moderation, be them aerobic exercises, yoga, or meditation. And rule number 5 is regular follow-up with your treating cardiologist so that he can identify the early risk factors, progression of the disease, or development of complications and guide you further. Thank you.